Okay, so today we're going to talk about ketamine as a potential treatment option for both pain as well as for depression. We're going to cover a number of different topics and really provide answers for this potential treatment that is being offered at a number of clinics that really is an old school treatment that now has really found its base in terms of helping people from two categories that really can be able to provide value. Throughout the course of this discussion, pose questions at any point in time. We'll be happy to answer those questions as they come up. So first of which, let's take and give you an insight about one of the papers that we're using really to kind of give some explanation. And one of those papers is the following. And that is Ketamine, an update on cellular and subcellular mechanisms with implications for practice. So I know that sounds incredibly fancy, but we're going to break it down so that it's easily understood and that there's not much challenge with getting to the base of understanding how does it work and why you might have some degree of benefit if you decide to use something like this. And also, what are the things that you need to know about so that you don't have potential risk or concerns that aren't really explained in depth and detail. So ketamine itself is an anesthetic that has been used in a number of different formulations, from traditional anesthesiology to the context of veterinary medicine. And it's not used as a mainstay quite as much because it traditionally has to be combined with something that's called a benzodiazepine. And that's a medication that allows for kind of a calming type state that's in association with the utilization of the medicine. And the main reason for that is that it can cause you to be very relaxed and to see certain things that you would say, is that really the case? Am I seeing hallucinations? What's the scoop? So accordingly, we're going to kind of get into what are some of the underlying issues with this and how it might be able to provide value. Okay. So for those of you who are joining us late, again, thank you for joining us. And we're going to talk a little bit about ketamine and the mechanisms of action. Okay. So one of the things to really be able to evaluate is, so how does this affect portions of the brain? And how it affects the brain is actually multifactorial, as a matter of fact. One of the things that we think about is it being utilized within the context of traditional anesthesia and it affecting something that's called the NMDA receptor. So the NMDA receptor stands for N-methyl D-aspartate receptor. And the value to it is that is really instrumental to the context of something that is mediated by going after nerve pain in particular. So when we talk about this, we're going to kind of give you a background, but basically this comes from that paper that I just alluded to a second or so ago. And one of the things that it really talks about is the context of how does ketamine really work? And so what historically has been the postulate for its benefit is by working on the NMDA receptor, which is traditionally associated with something that is called wind-up. So wind-up is when you have a nerve pain that starts and it continues to propagate and it just continues to give you this issue time and time again. And you're like, oh my gosh, this just won't seem to stop. And it's recurrent without it being specific for pain that you would truly that you need to know about. So it's not nociceptive, meaning nociception is where you have pain that gives you a pinch and you need to know that because that way you don't have tissue damage. But when you have chronic pain, at times you will have pain that seems to worsen over a period of time frame because of these various different molecular mechanisms that occur that can cause problems and issues and really just cause you more pain than what you need because it's not actually telling you, hey, this is a problem and you need to address it. More so, it's giving you a problem and you're kind of stuck dealing with it. So as you can see, there's a number of different things within this pathway that talks about AMPA, it talks about calcium and intracellular calcium and all these various different pieces that are mitigated by the use of ketamine. But at the end of the day, what you really need to know is that it affects calcium and its inflow into the cells. It also affects magnesium, and these pink boxes here are the things that talk about this modulation of long-term potentiation as well as central sensitization. And so that is the actual underlying premise behind how that pain, once it starts from whatever insult, it continues to become an issue chronically over and over again. So let me focus on that key point one more time, right? So how does ketamine work, particularly for chronic pain? It focuses on those various different intracellular mechanisms that affect that channel that can be able to stop those pink boxes that we just saw a second or so ago that really deal with that long-term potentiation, fancy words for saying pain that continues going over and over again. And really what we want to be able to do is find a way to stop that from affecting various different parts of the brain. And as you can see, it affects things like the hippocampus, it affects things like the prefrontal cortex, and it affects things like the rostral ventral medial medulla, right? So all of those things are implicated in its use. Pardon me. So when we get down to the actual specific cellular mechanisms, it looks something like the following. So as you can see, you have this component of the nerve. There's both a postsynaptic and there's a presynaptic. So when we talk about the nerve and it's actually having that electrical signal that goes from one area to the other, it releases various different neurotransmitters that then go across to the other context of the nerve, the other kind of part of that synaptic cleft, and that then stimulates further responses. And some of the things that mitigate that response are the utilization of that receptor that I referred to earlier, and how ketamine can decrease or change what's going on within that synaptic cleft, right? So I know this is very fancy and it's getting really scientific, and it's like, well, how is this going to potentially help me? So that's what we're going to talk about in just a second, and how ketamine can be utilized and who might be people that actually can benefit from ketamine. So fact of the matter is, it can be able to help individuals with complex regional pain syndrome. It can be able to help people that have non-responsive nerve type issues. It can be able to help people that have things like more myofascial type complaints, things like fibromyalgia and possibly polymyalgia rheumatica. And so it's been used in a lot of different contexts within that. There are different formulations of ketamine, everything from oral to IV to intranasal. And so how those things are provided and the mechanisms that they're utilized vary depending upon the condition. But one of the things that has been really kind of revolutionary, if you would, with ketamine's use is its use particularly in mood stabilization. So one of the things that we've seen is that it's been prominent within the context for major depression. And it was actually pulled within the context of Harvard Health's blog, where they looked at different evaluations of this. And what they were able to see is that when you talk about different things like Spravato, for instance, that's the intranasal formulation, it's ketamine. It's been approved and it's utilized for indications that are major depression that hasn't responded to traditional medication. And I think if I was posing this from our normal patient population, that our viewers that would be watching this video right now, I know they would say, well, you're a regenerative medicine doctor and you're a pain doctor. Why are we talking about depression as a potential treatment that is linked to pain? And I think, just to be forthright, fact of the matter is, most people that have pain, whether they readily admit it or not, have some form of depression. And the reason why is because you can't do the things that you would normally be able to do without having to, at the very least, consider and think about it, number one. Number two, it very well actually stops you from doing many things that you love to be able to do. And then in addition to that, frequently, pain is not that well supported in terms of treatment from other physicians, from family members, and social strata as a whole, to say, you know what, we understand you have pain. This is how we're going to cooperate with you. And most of the time, people will, to some extent, suffer in silence. And that suffering over a period of time can certainly cause depression and affect various different elements of mood, sleep, and just interaction as a whole. So if we don't look at that patient from a more holistic standpoint, then we kind of really lose the forest for the trees, because we're just trying to treat the one part and we're not treating everything else that really makes you and what helps us identify your why in order to be able to address this. So there's certainly a connection between the elements of nociceptive pain, meaning feeling it, as well as how it affects your overall mood and state. It's one of the reasons why we had a video in the past that talked about neuroflow that allows for you to be able to assess things like depression and anxiety, and how can we be able to pull that data over a period of time so that person can see, you know what, I had good days on these days, I had bad days on these days, and maybe there's some rhyme or reason to this. And then how can my healthcare provider be able to help us with that? Well, this is an easy, direct conduit to say, would you potentially need to utilize something like this? Why is it a benefit compared to SSRIs or TCAs or other potential treatment options for depression? It's not necessarily a mainstay. It is actually more of a secondary, even a tertiary medication. But when those medicines don't actually work, then how do we treat it? And so one of the ways to be able to do that is to utilize a medication similar to this. So ketamine as a whole, when we kind of get into the context of text, it does a number of different things. And that is, it can be able to help deal with pain that results from a tolerance to opioids. It can be able to provide different mechanisms of relief. Many opioid channels are focused on the mu receptor, and ketamine actually acts in different ways to be able to deal with pain and give a different type of response. And so when you read through this, it talks about analgesia, which is another way for being able to say that it's insensate to pain. And the other value is that frequently patients can get something that's called opioid-induced hyperalgesia. And I know that is a complete mouthful, which has just turned everybody off and made you guys go to sleep. But it's actually a pretty interesting concept and really is important to patients. So what's opioid-induced hyperalgesia? What that means is, so if you're using a pain pill, something that contains an opiate, whether it's a Norco or morphine or something along those lines, with enough usage and potentially enough dosage, there is believed that that medicine can do the exact opposite of what you would expect. And that is, traditionally, we expect those medicines to be able to provide pain relief. But in those contexts that I just mentioned earlier, it's believed that it can affect the nerves and cause pain. So the difficulty with trying to be able to treat and figure this out is that it's very counterintuitive. If you're someone who has pain that is intense, that's searing, that's continuous in nature, and you're using a pain pill in order to be able to take the edge off, and all of a sudden the doc comes to you and says, you know what, I think your pills might be the underlying cause for why your pain might be worse. I think we should stop those pills and then see whether your pain gets better. That's a hard sell. I mean, you could almost sell a bridge to someone at night to say, hey, you could purchase this, as opposed to being able to convince someone that their pain pill is causing that pain, right? So traditional strategies are to do either a complete opioid holiday or to do something that is called an opioid rotation, where you switch from a pain medicine of one type to another, right? But the problem and the challenge is multifactorial. Number one, a holiday is really tough on a lot of patients, and you may have some withdrawal symptoms if those aren't accounted for. But number two is that when you switch to different medicine, you don't know whether that other medicine is going to agree with you. You might need to do some pharmacogenetics evaluation or assessment, but most of the time that's not in place. So you just have to try the medicine. And in trying that medicine, you may not know its efficacy immediately, because it'll take time to get to a certain level of serum concentration within your blood to see how effective it's going to be. And then finally, your insurance may not even cover that medication. And so you have all these different things that are in place. And so how could ketamine be able to be a potential option? Because it works on a different receptor than what most opioids do. As alluded to before, it works on that delta aspect of a receptor and can be able to improve the context of opioid-induced hyperalgesia. We're also giving you pain relief at the same time. So that is one of the ways in which it was a potential issue. So there's actually a question that has come up from one of our listeners who's and viewer who's a pretty prominent viewer, and we thank Elaine for being with us today. And one of the comments that she has, and she's a pain nurse that I worked with personally in Chicago, was ketamine was taken off the market in the past. I remember we used to do IV infusions for sympathetic dystrophy, and we weren't able to get it. So yes, it was. Yes. So the major issue is it has been that we weren't able to get it for a period of time, but that has changed markedly. So when we look at ketamine currently, it has definitely taken off as used for both traditional pain as well as for the context of depression. And it's being used nationwide for benefits, both within the context of something like complex regional pain syndrome, but also for usage for depression and a number of other nerve pain treatment options. So when we talk about ketamine as a whole, it's a medicine that really fills a gap where many other treatment options haven't been utilized as much or haven't really been successful. So particularly for things like fibromyalgia and other treatment options that rely on myofascial problems, to really be able to provide a different option, either in addition or in lieu of standard mainstays, really provide a unique, satisfactory treatment that otherwise wouldn't be in place. Ketamine can be delivered in a whole host of different contexts, everything from IV treatments dosed differently. You can use ketamine to do full-blown anesthesia. You can use ketamine to be able to use subclinical doses. You can use it with different intervals in terms of how you receive it, as well as those mixtures, as mentioned before, like intranasal, where you can be able to use it for depression, which really has found its niche. Traditionally, for a treatment like that, normally you will have had to see a psychologist and or a psychiatrist first to be able to have appropriate diagnoses that then would allow for your insurance to potentially be able to be used for Spravato or esketamine. Traditional IV infusions normally aren't traditionally covered by insurance, but their benefit that would prevent you from needing to have to take a pill daily may be more substantial, that you say, you know what, I'd much rather do this than do certain nerve pain meds over and over again. So in getting to one of the things that we really want to be able to kind of ask questions of the viewers and audience is, have you heard about ketamine before? And if you have, what was it used for in that context? Was it used for more depression? Was it used for more pain? And if so, what were the results that you experienced and that you had when having that provided? Personally, I've seen where someone's had a crush injury, meaning they've had their foot crushed in a trauma from a car or a truck, and had something that's called complex regional pain syndrome, or previously it was called reflex sympathetic dystrophy. And their skin was modeled to a different coloring than what they normally would have. It was incredibly sensitive to the touch. And we tried a number of different things. As alluded to before, things like lumbar sympathetic blocks. We did things like spinal cord stimulation. We did dorsal root ganglion stimulation. And the mechanisms of action of ketamine are a little bit different so they can be able to get a different result. At the end of the day, what we really want to be able to do is to figure out a way to be able to help patients punch pain in the face and get back to leading the life that they deserve. And one of the ways to do that is by knowing all the different options on the table so that you can be able to really live your life and live the life that you deserve. So for those of you who are watching, what we'd be interested in is either you're watching it live or you're watching it later. Please leave comments below this video to let us know what was your experience and exposure with ketamine? What are your questions about ketamine? And how we can be able to be a resource so that you know all your options for pain relief. Again, thanks to you for joining us. And please stay tuned next week for us to talk about other topics dealing with pain management, regenerative medicine, and minimally invasive treatment options in order to help you be more functional and be able to lead the life you deserve. Thank you.